So one really cool thing you can do to offer something different for your psych practice that really is going to make your psych practice stand apart is offering genetic testing. So genetic testing, we are doing the MTHFR, and we are also doing the psychotropic test. When you log into your dashboard, you are going to see a screen like this, which basically shows all your orders, status of orders, right? So we see some complete. I haven't reviewed that one yet, so I'll go over that one with the patient. To place an order, really simple process. Just click new order, and usually they take 3 days turnaround time, so it's really fast. So just patient's information goes in here. If you have their insurance information, you can upload it. It's really simple though. You want to put their number in there, so they have, they'll get a text link when it's resulted. Now, they will not get the results until you share them, because we don't want patients having test results before we get our eyes on them for obvious reasons. They may make some rash decisions. Ship to patient, right? And then continue. When you get to this next screen, we want to either choose self-pay, which with the discount for self-pay, I think it comes out to around $100, depending on their income level. But if they do have insurance, basically any commercial insurance is under unknown or other. So you can send it with the sample. You can upload pictures of the cards if you want to pull them out of the EHR, or you can enter them in there. So very simple to do. We're just going to pretend we're going to self-pay here. We're going to continue on. If it'll let me, there we go. All right, so what we want to do is we always want to use a depression diagnosis and anxiety, and an anxiety diagnosis if we are trying to get it covered by insurance, or any kind of mood disorder is going to work. So bipolar will work too. You want to put in as many of these as you can, because you have a better chance getting it covered by insurance if they have multiple failures. So it's based on attestation too. You don't have to go digging through records or anything like that. Yes, we want to augment possibly. Are we trying to do some dosage adjustments? Maybe. Have we considered non-genetic factors? Yes, we have. Do we want to look at MTHFR? Yes, we do, right? Continue. And then there's just going to be essentially a place order button. That's it. It's very simple. Results come back very fast. On our results page, what you're going to see is 2 separate clickable buttons. You have MTHFR and psychotropics. You're going to see all their psychotropics, what category they're in, what number corresponds with what genetic mutation, right? So you're going to see, and this is somebody's actual report, of course their name's blurred out, but you can see it'll tell you what medications may be good for them, what medications may or may not work. These kind of getting into the weeds, we don't need to. Basically, the patients are able to even understand what these things mean. So remember, this is not a diagnostic tool. It is a tool, not a diagnostic tool. Then we also have the MTHFR. You can see this patient has a reduced folic acid conversion, so we'd probably start them on MTHFR. And to send the report to the patient, simply click that Send Report to Patient button and send link, and the report will go right to that patient. So very easy to deal with, very easy system. You can call GeneSight and get an account set up like that. It's very quick to get the account set up, and you can market it, and it'll make your practice stand out a little bit. People love to know that the provider's, going to the extra mile and taking a look at everything, and making sure they feel heard and they're getting the best possible care, and they have a chance at the best possible outcome possible.